World AIDS Day is held on the 1st of December each year, and it is an opportunity for people worldwide to unite in the fight against HIV, show their support for people living with HIV, and to commemorate people who have died. World AIDS Day was the first ever global health day, held for the first time in 1988. South African National AIDS Chairman Cyril Ramaphosa will today take the podium at Sanaba Stadium in Davidton. He'll be joined by Health Minister Aaron Motsoaledi, Gauteng Premier David Makhura, and members of civil society. The Deputy President will talk of the strides South Africa has made in reducing the impact of HIV and AIDS since it eventually rolled out antiretroviral treatment during the denialist days of former President Thabo Mbeki. The South African Medical Research Council's 150,000 people died from HIV and AIDS in 2012 compared to 300,000 in 2006-2007. The rollout of ARVs and the earlier prevention of mother-to-child transmission intervention remain key areas of focus. And joining us live in our Midrand studios, we are joined by the Provincial Coordinator for the Treatment Action Campaign, Stephen Hobo. Thank you so much for joining us here on Morning Prime. We really do appreciate your time. Firstly, how is TAC involved in World AIDS Day?
Okay, thank you for this, Lauren. TAC is involved through planning and engaging with South African National AIDS Council. However, TAC also is an independent organization, rather than being part of being South African National AIDS Council, or SANAC in short. TAC is actually, let me say, last night, the whole of last night, it had a night vigil with all its members across Gauteng who represent the views and frustrations of South Africans in general. And it was Gauteng because the World AIDS Day is celebrated in Gauteng, which is our province, but it is celebrated nationally in Gauteng. As a result, our people came in numbers from different areas of Gauteng to raise the frustrations that they are still experiencing, irrespective of the fact that there is progress of people, for example, taking treatment. But still there are challenges that people will still be turned back, irrespective of how they think the issue of Stockholm is being addressed. But people on the ground are still complaining. And today, TAC is going to be marching, or could be already marching, to where the World AIDS Day is. The Deputy President is aware, the Minister is aware, the Premier of Gauteng is aware. And of course the MEC of Health in Gauteng is aware of this march. The march is basically about one, the fact that when we had International World AIDS Day, International AIDS Conference in Durban, there were demands that TAC made together with international civil society. Part of these demands was that there should be a comprehensive sexuality education policy on that, as well as access to condoms in schools, because young girls, as you know, more than 2,000 a week in South Africa, more than any other country in Africa, are getting infected with HIV for that reason. And those are part of the things that we demanded, but up to this far, there is no policy that has been brought forth. So TAC is making a march.
And what was the reaction to those demands?
Yes. Yeah, I think the reaction then in July were acknowledged and accepted by our own government. However, the main thing is they did not deliver on them. Before World AIDS Day, we said they should deliver before the World AIDS Day. Not just those, even others, where it talks about committed care workers that are being frustrated, not being fairly paid, not being fairly treated, and the fact that they are being divided by the manner in which they are being paid. Because they form the backbone of national health insurance. And if the committed care workers are not being well treated, then it defeats the purpose of us building towards a national health insurance that is going to unify health system in South Africa. So we're also demanding a policy and a reinstatement of them, as well as a policy that is going to absorb them on full-time basis.
So that march will be happening today?
Yes.
Now, let's talk more about World AIDS Day. Studies have revealed that gains have been made in the fight against HIV and AIDS in South Africa. However, the figures still remain very high. Tell us more about these gains and yet why these figures still remain high.
Yeah, no, definitely there are gains. For example, when you look at the mobilization of the community on the adverts of TV, like the one that says "Test a Boy," encouraging young men to go for HIV testing, I think it touches the men to say, I can't ignore this. I'm seeing this every day when I'm watching whatever program that I like. Soon after it or before it, it is there on my face. I think it, I think, and it encourages the girlfriends and the wife to say, you see, the advert says you must go and test as well.
And that's
rather than
education.
Yes, I think, yeah, it does. And the young men already who are speaking there, taking responsibility as young men to say they are also contributing as young men by having multiple partners. I think having a repetition of this will talk to the young people, I think. And basically, there is communication. However, the weakness of Estay is that, for example, today and days before, especially today, government will be going to communities, the government itself and the civil society that sits in SANAC or South African National AIDS Council, District AIDS Council and local and at provincial level. They'll be going to communities. But the thing is, why were they not doing this? Days before, months before, year by year, since national South African National AIDS Council takes five years, every month they should be doing these things, going to the communities, not react towards one day. It can't be correct.
I agree with you.
Yeah.
Now let's talk about the stigma attached to HIV and AIDS. Is this still a major issue in South Africa, or is it slowly but surely, improving? And what initiatives are aiding to this improvement of the stigma of HIV and AIDS?
Yes, yeah. I think a stigma index was done by government through Human Research Council. And it was shown that there is stigma, but mainly there is self-stigma, internalized stigma, where people, they themselves who are HIV positive, some of them are not comfortable with being HIV positive. They are not even disclosing within their families and within the community, let alone to the world.
And did they find that most of these people do not get medication because they have this internalized stigma?
And it also becomes a problem for people to go for HIV testing, even if they could suspect that they could be HIV positive, based on certain reasons that they could be observing. Yes.
But you have seen improvements in terms of the stigma attached to HIV and AIDS.
Yeah,
people
there is
are more
improvement.
welcoming.
People are now welcoming and embracing now and normalizing being HIV positive as part of being.
And then lastly, let's talk about this new vaccine.
Yes.
I mean, Twitter has been going mad with it. How does it work, and what is the reason behind the suspicion of this new vaccine? Why are people not too happy about it? Why are they very suspicious about this new vaccine?
I don't have much facts on that. However, what I can say is that the issue of vaccines has been spoken about for many years already, and there was seemingly no hope, because there would be a hope for vaccine. Suddenly it disappears, it did not work. And remember, the issue of vaccine takes years. It does not just take. Between the time when a vaccine is being developed or researched, people are still be infected. And it will be giving people hope, which is good to live on hope, but it would be an unfair and false hope if 4 years, 5 years later, the vaccine, or even before then, it is found to
not working.
Yes. So we need tangible results. Until then, we can't celebrate nothing.
Mr. Ngcobo, thank you so much for joining us here on Morning Prime. We really do appreciate all your time. That was Stephen Ngcobo, the Provincial Coordinator for Treatment Action Campaign. They're talking about the fact that today, the 1st of December, is World AIDS Day, talking about the improvements made as well as some of the setbacks